Before 2011, the West African Francophone sub-region was characterized by low contraceptive prevalence and the highest fertility rates in the world. Family planning interventions were almost non-existent and FP services were often inaccessible. Urgent action was needed. Faced with these challenges, the 9 West African Francophone countries, Benin, Burkina Faso, Côte d'Ivoire, Guinea, Mali, Mauritania, Niger, Senegal and Togo, and their technical and financial partner decided it was time to invest in FP. They launched the Ouagadougou Partnership in February 2011 at the International Conference on Population and Development in Burkina Faso. This partnership aimed to accelerate progress in the use of family planning services in the sub-region. The same year, civil society expressed its desire to take part in this novel project. It formed coalitions and received support from the Civil Society for Family Planning, a program funded by the Hewlett Foundation and implemented by IntraHealth International to strengthen the capacity of civil society in OP countries in order to reposition FP. In 2012, the Ouagadougou Partnership Coordination Unit, based in Dakar, Senegal, was established with Fatima Tassi as director. The OPCU is responsible for coordinating the partnership's actions and relations between donors and countries to achieve its objectives. It was also in 2012 that the first phase of the OP, named Urgency to Act, was launched to enroll 1 million additional users of modern contraceptive methods by the end of 2015. The costed implementation plan's elaboration process also began that same year. The other major event of 2012 was the launch of FP 2020 during the first London Summit, where 4 countries, Burkina Faso, Côte d'Ivoire, Senegal, and Niger, made FP commitments. 3 other countries, Benin, Mali, and Mauritania, followed in 2013. At the 2015 OP annual meeting in Cotonou, stakeholders marked the end of the Urgency to Act phase by celebrating the successes achieved by the 9 countries. Indeed, they cumulatively surpassed the goal of 1 million additional users by enrolling 1,306,000 additional users of modern contraceptive methods. With these encouraging results of this first phase, the Ministers of Health of the 9 OP countries validated the acceleration phase and set a new goal of reaching 2.2 million additional women by the end of 2020. To meet the ambition to expand exchange opportunities between the OP stakeholders, the OPCU initiated the Donors Caravan. It provides an exceptional opportunity to support countries in their effort to implement CIPs, to celebrate successes, to analyze factors that hinder the acceleration of interventions, and to agree on solutions. It is also a moment of advocacy with the various OP stakeholders and an opportunity for different exchanges between donors and local implementing partners. The OP Magic Recipe is the friendly emulation between the 9 countries to motivate each other to achieve results. 2 important events marked the year 2017. The first was the second London Summit, during which the Ministers of Health of the 9 OP countries reiterated the commitment to family planning, and the others was the arrival of 2 new donors, Canada and the Kingdom of the Netherlands. In 2017, Mauritania adopted the draft law on reproductive health. Senegal reached a contraceptive prevalence rate of 18.5%, doubling that of 2016, which was 9.1%. Côte d'Ivoire has reached and far exceeded its target in terms of additional users. Indeed, out of the 176,400 expected, the country has achieved 271,338, thus exceeding the planned number by 94,938. In 2018, Burkina Faso distinguished itself by taking the decision by decree to make FP free throughout its territory. This decision served as an example to other OP countries. Also, in 2018, Burkina Faso had the strongest growth during the acceleration phase, with an increase of 4.3% in just 2 years. A complete and accurate mapping of FP initiative in the 9 OP countries was established. Then, building on the achievement of the first 2 phases and taking stock of persistent challenges and unexplored areas for intervention, the Ouagadougou Partnership launched in November 2019 a process named PO après 2020. This process gave birth to a new vision: That of a Francophone West Africa where easy access to quality family planning services saves and improves women's and young people's lives. This new vision is set to act as a catalyst for a new goal: reach 13 million total users of modern contraception method by 2030, doubling the current number of 6.5 million. Two major partners, the UK Department for International Development and the Children's Investment Fund Foundation, joined the OP. The partners also decided to localize the leadership and management of the partnership. A new director, Mariba, was appointed to lead a dynamic team, reinforced by country liaison officers and youth leads. This development has also seen Speak Up Africa, a platform based in Senegal dedicated to the implementation of concrete advocacy actions in favor of sustainable development, take over the OPCU support services. All this has contributed to a stronger institutional grounded in West Africa and encourages local leadership. At the end of the acceleration phases, precisely in December 2020, the OP reached and exceeded the target of 2.2 million additional users of modern contraceptive methods set by registering 184,000 more than expected. In summary, during the first 10 years of the OP, contraceptive prevalence rates doubled in most countries. The 9 members countries added 4,077,000 modern contraceptive users, bringing the total number of users to 7,033,000. By comparison, between 1990 and 2011, in 20 years, these same countries added only 2.5 million additional users. The overall OP impact since its launch is enormous. 18,848,000 unintended pregnancies averted, 6,697,500 unsafe abortion averted, and 63,740 maternal deaths averted. Also, reforms and laws in favor of the sexual and reproductive health of women and young people have been adopted and promulgated in several countries. Institutional changes made FP stronger in the countries. For example, Burkina Faso, Niger, and Mali have all raised the importance of family planning within health ministries, with the creation in February 2018 of the Technical Secretariat for Demographic Acceleration and Transition in Burkina Faso, the Family Planning Direction in Niger in May 2019, and the National Office for Reproductive Health in Mali in July 2019. Taking into account all these advances and the challenges yet to be met, stakeholders are resolutely looking to the next 10 years. Initiative strategies have been developed to achieve the ambitious goals of adding 6.5 million additional users by 2030, with a focus on youth, research, social norms, family planning in a recurrent crisis context, with an increased contribution of civil society.